right, hello, health heads. Welcome and thank you for checking into this dose of the Healthcare Uprising. Once again, with the Your Vote, Your Health series, very special event episode in my mind, honestly. But I'm going to let the woman do her job. What's on our agenda for today, Heather?
Thanks, Jeremy. The woman's going to do her job.
Woman, do your job.
And hey, guess what? We have a woman who is doing her job, and that is Khara House. She is a current Flagstaff City Council member since 2002. She is up for re-election, and so running again. But Khara's not only a city council member, but she also brings a really great perspective to this particular series because of her healthcare background. She's the associate director for the Center for Recovery and Behavioral Health at an organization called C4 Innovations. And so she's very well connected in the community with housing, which is plays massively into healthcare. We talk about that all the time, social determinants of health. Very well connected in this in our community, and she's a badass, and I'm super excited that she came on. So
I'm really glad to meet her. But yeah, Flagstaff City Council person on the Uprising on the 4th of July release. I couldn't ask for more. So without further ado, here's our conversation with Flagstaff City Council member Khara House.
Hi, and welcome to the Healthcare Uprising podcast. And today we're dropping a Your Vote, Your Health series. And we have with us Khara House, who is a current city council member and associate director for the Center for Recovery and Behavioral Health at C4 Innovation. So she's a local.
Yay.
Welcome to the show, Khara.
Thank you so much.
We're so excited to have you. You're our first local Flagstaff guest on the Your Vote, Your Health series.
Mm-hmm.
So yay for that. I voted for you.
Yeah.
Yep. So very happy to have you and love your background, which is why I reached out to you. I knew that you had worked in kind of the behavioral health, mental health space, and thought, well, gosh, she's a city council member. She's running again. Let's get her on the show. So here we are. So tell us a little bit about your background before we start kind of diving into some of the deeper questions. A little bit about your background in behavioral health and obviously what you've done so far kind of in the local politics scene. And you're always out traveling around. I follow you on LinkedIn doing some cool stuff.
Yeah, absolutely. Well, thank you so much for having me. It's a joy to join you, and excited to hear that I'm your first local guest. That's awesome. So I came to Flagstaff in 2009 to attend Northern Arizona University, go Lumberjacks. Graduated with my master's degree in English, spent about 2 years teaching at the university, and then transitioned into a career actually in multifamily housing. And my career was in housing for a little over a decade before I transitioned into behavioral health. My work in multifamily really kind of worked at the intersection of housing and behavioral health. I was involved in and served as and still serve as a board member for the Flagstaff Shelter Services. And so engaging with our population of community members experiencing housing insecurity or homelessness. There's a lot of intersections and overlaps in some of those experiences, as well as just some personal background with lived and living experience and being the family member of folks with lived experience with behavioral health concerns. You see how they all just kind of mesh together and work together to impact overall community health, wellness, and how people thrive within a shared community. So that's really where my background came from and where I came up in the industry. I also, my dad has worked in behavioral health my entire life. He started off as a caseworker and now works in a lot of community development work and newsletter writing and coordination of things. And so just growing up with that as part of the background really was eye-opening for, the way that communities are shaped around the health concerns that really impact us all.
Yeah. Yeah, it's I love it. One of the other things that I love about your background and your experience, Kara, is the work that you do with housing. We talk a lot on the show, even outside of the Your Vote Your Health series, about social determinants of health and housing insecurity, being unhoused, like all those things that are associated, um, are they just play into your health at the end of the day. You know, whether you have a roof over your head, and what becomes priority, right?
Yeah.
And often health taking a way back seat. So,
Yep. Plumbed hot water is huge for general health.
what is that?
Just plumbed hot water. Being able to wash your hands with hot water. That
Oh,
alone is
plumbed hot water. I was
Plumbed
like, what word are you
hot
saying?
water, yeah. But that alone, like, you can't have that unless you're in place, right?
Yeah, that is true. So, Kara, obviously you bring it, particularly to this series. I mean, you're on city council. Um, you're running again, and I want to talk a little bit about what that means, right? Because I think a lot of people, when they think about different people in political positions, right? You're like, oh, well, you can make change to healthcare at a state level, right? Or Senate, all those positions. I think sometimes people in the communities forget how important city council what kind of impact it could have on healthcare. And I think it is directly tied to the social determinants of health, like housing and food insecurity and transportation and all those things. So I imagine from a city council perspective, that's where you probably have a lot of impact as well, like just outside of direct health, mental health, that sort of thing. So can you talk a little bit about what that means and just kind of explain, like, what kind of role does city council play in impacting people's health and well-being in those communities, and why does it matter who you vote for at the end of the day?
Yeah, I feel like it's a wonderful question. It's so multifaceted. I feel like one of the things that has to be said up front is that, as much as I wish it weren't the case, it's really important for people to acknowledge and know that we can't solve at the council level every part of the behavioral health system, or the challenges that we face. Um, so much of the funding and regulations around all of that happen at the state or federal level, but that's not to say that local government doesn't still play a role. And I think we still play a pretty important one. And it's that, we have the opportunity to forge a lot of partnerships. And that's really where we come into play. We can bring people to the table who may not often be invited there, or who may be working in a lot of those separate lanes that we don't often think about, whether that's hospitals, behavioral health providers, housing providers, first responders, recovery organizations, schools. All of those things we have the opportunity to bring to a shared table and engage in those conversations, to align around our efforts and our goals when it comes to behavioral health. We are not a primary funder especially at the Flagstaff City Council level of behavioral health, but we do make budget decisions that are affecting housing, homelessness response, public safety, transportation, all of those things that influence community well-being and that speak to, as you mentioned, the social determinants of health that we really have to keep in mind. So we have, that in our wheelhouse and at our disposal. We have policy tools at our disposal where we can support housing solutions, strengthen crisis response partnerships. The city has really taken a lot of innovative steps when it comes to our care unit, which is an alternative response, and
Yes, I'm so glad you mentioned that. Yeah.
yeah, a lot of great things happening there, and seeing that advance the community's awareness of not only behavioral health, but also how we as a community can respond to that in a way that's not criminalizing, but it's actually providing community care in collaboration with a lot of different entities. That's a huge thing to be able to provide from that council level.
Yeah, I'm so glad you mentioned that. As you were talking, I was thinking about those CARES units. It always makes me happy when I see them show up, because I'm like, good, that's a good thing.
What's the
Yeah.
number? 988 or something like that? What's the number you call for those guys?
Oh, I don't know.
You know, I never remember off the top of my head what the number for the care unit is, but 988 is such an important resource that I know we have an Arizona specific crisis line.
Oh, that's what it is.
988 is a national crisis hotline that is really more of a warm line, because hotline you're calling when things are pretty much as bad as it gets, and with 988, it's an opportunity for people to reach out regardless of where they're at. If they just have questions, if they're feeling really down, or if they know that they need support but aren't sure where to turn. If they know of a loved one who's struggling and they have no idea, what do I say to someone? I really need support in that. 988 is a wonderful resource that I've had the opportunity through my work with C4 to work with more directly in understanding how they are really providing 24/7, non judgmental, meeting people where they are support for the behavioral health needs of communities across the country, including
Yeah.
communities like Flagstaff.
Yeah.
I'm glad I stumbled us into that.
Yeah, thanks. It's actually like a good little PSA there.
I'm going to find the local number for those local care units and put it in the show notes.
There you go.
Who's watching or listening.
Yeah,
Perfect. So, Khara, how long have you been on city council now?
I've been on council since 2022.
2022.
So I was appointed to the council that April or May, and then ran as a write-in that November,
Mhm.
and was elected to a full 4-year term at that point.
Nice.
So you're okay, right? So your term's coming up, which is timer. Yep, this is why we're doing this show too, because we're running into these midterm elections, and there's a lot at stake right now.
Yeah.
So
We're trying to get as many of these in before November as possible.
yeah. So you've got tell us a little bit about, because I think this is so important in this conversation, your background and your role with the C4 Innovations. What do you do in that position, and how does that kind of parlay into the work that you do as an elected person here in Flagstaff?
Yeah, so my work with C4 started, I originally joined their team as a senior writer, working for a program under SAMHSA, which is it's the Substance Abuse and Mental Health Services Administration under HHS at the federal level. And we were running a program for them called SPARK, which was focused on advancing recovery knowledge across the nation. Through that work was where I really got involved in a lot of recovery conversations about recovery frameworks, building in cultural responsiveness to community needs when it comes to recovery needs and behavioral health needs, and starting to have a lot of those conversations about the intersections of treatment, prevention, recovery, and just ensuring that needs of communities are being met. Now my work is very much focused on that recovery and behavioral health aspect, where we're doing a lot of work with states and communities around building recovery integration into their communities. We work a lot in the prevention space to develop learning opportunities and training opportunities for folks on best practices and community adaptations for prevention. And all of those sorts of things kind of circle around the work that I'm focused on here in Flagstaff. Through that work with SAMHSA and the SPARK program, and with C4, I came to a lot of knowledge about the concept of recovery-ready communities, which is basically speaking about that fundamental understanding that communities are a place where people don't have to leave their community or lose everything or hit rock bottom before they can access support. And so it's building in a lot of those frameworks and that understanding that if we are providing care for the people who are experiencing the most need or living with behavioral health conditions or crises, trying to navigate recovery from both mental health and substance use conditions. If we can provide that care within the community, then we're really doing a lot of good for everyone in the community. And that so aligns with the work that we do in Flagstaff, where our mission is literally to protect and enhance the quality of life for all. I have that memorized after reading it at the beginning of every council meeting. And if we are really caring about protecting and enhancing the quality of life, then that is so rooted in the social determinants of health. It's rooted in concepts of recovery and the belief that whatever pathway people take, it can lead to their overall wellness, their well being, their ability to recover, and their ability to live fulfilling lives where they're thriving, not just surviving in community.
Okay. Recovery ready community. Now, is that something that most cities and towns uh, aim to achieve? Or is this something pretty unique to Flagstaff? I had never heard the term before when you and I spoke for the first time.
Yeah. So it is, I wouldn't say it's necessarily a new or unique concept, but you see it a lot more actually back east. The state of Kentucky has really pioneered a lot of this work as they were recognizing just the major impact of substance use and opioid misuse and
Yeah.
other conditions throughout that state. Their determination was we really have an obligation to do something about this. And so they established a set of core principles and guidelines that guided a lot of the work that they were doing in recovery readiness. And that whole framing was built on the idea of recovery not being treated as something separate from everyday life, but being truly part of our housing, our employment, transportation, public safety, community connection, and local decision making. So, with that, they started establishing programs of local education, making sure that communities were aware of all of the resources that existed, bringing together community coalitions that were really bringing together all of the siloed groups, whether it was schools or the law enforcement, public safety teams, everyone coming to the table to talk about what is the challenge that we're facing, how can we recognize what already exists here, and how can we start to identify the gaps that exist in that care so that we can really start making a difference. They actually, in the state of Kentucky, now have it down to such a science or down to such that dotted I's and crossed T's level that they actually do city and town based certification as recovery ready communities,
Oh,
where
wow.
so many communities throughout the state are literally signing off on these are all the things that we've done to advance this as a concept. And so we are officially a recovery ready community. What I brought to Flagstaff was a resolution that said that, we're not a recovery ready community yet, but we are certainly willing to work towards that. We want to enhance community education. We want to enhance awareness, and we want to be partners, active partners in this work of recognizing the needs of behavioral health and recovery in our community and actually doing something about it so that we can be supporting all of our community members. Because it's my belief that when you're meeting people where they're at, especially when they're at their lowest point, as you're raising them up, you're elevating everyone in the community. You're making things better for all of us. And that's really what I think protecting and enhancing the quality of life is all about.
Yeah. I love that. I agree with you. I think you do too.
It was very recently, a recent episode, I did talk about how the lowest quality of life in the community
Yes.
is what you got to base the whole judgment on. Like,
Yeah, you
Yeah.
did talk about that.
yeah, I forget exactly how I said it before, but yeah, it's very much to the point on that.
Yeah, what's that saying? The all something with boats in the water.
Rising, A rising tide lifts all
lifts
ships.
all ships. That's right. And oh my gosh, I think we're talking about socialized healthcare.
Oh, oops.
That
Oops.
keeps coming up too, doesn't it? Like,
it
you
does.
start talking about rational solves to all these healthcare problems.
Yeah.
And so much of it, if you really just objectively and rationally and logically think about it, it comes down to maybe we should just have a single payer system.
Yeah. Let's take care of one another, right?
Like, it's sitting right in front of us. It's where all the paths lead, man. Like, what are we doing?
You know, and speaking about this, and this is a Flagstaff specific thing I'm going to mention that I've learned about that I didn't know existed, but through the power of the Flagstaff Leadership Program, which I just was on the board for, and Khara, I think you're you know those folks. I met a guy who just graduated from, I think it was the class after me, and he works in what's called like the I'm gonna screw this up, but it's like a recovery court, I think.
Yeah.
Do you know Jesse Heath?
I feel like I have to have heard the name.
Yeah,
but yeah, I've heard so much recently about the recovery court program.
Yes. Oh my gosh. Like, it was really amazing when he told me about recovery court and what that means. And it's so tied, I think, to what you're saying, Khara, is like this kind of being recovery ready. How do we show up in different ways? Well, you have recovery court, which is instead of sending people off to jail, right, there's these rehabilitation programs that you can essentially, I think, is what you go through. Now, I don't want to speak like I know what I'm talking about here.
I can tell you this, about once a week, and I often take it, about once a week I get offered a ride from Flagstaff City Jail to one of the rehab units down in Phoenix or Chino Valley or Prescott or the one in Apache Junction is very popular these days. I've been there a few times in the last month.
Oh, okay.
But there's a woman, I don't know if it's through the advocate program or what, but maybe it's what you guys are talking about. It's the same woman who works there who comes out with them every time, who's ordering the ride.
Oh, okay.
And I pick them up and drive them to the rehab instead of them going to jail.
So, yes, anyway, recovery court was something that I was fascinated about learning and the way that Jesse had explained it to me is he himself is in recovery, and he showed me when we went to the jail. Actually, he showed me the oh my goodness, is it called a Hogan?
Yeah.
That they have on the campus there. Because we have, we live right next to the reservation. We have a lot of Navajo and Hopi. That's an important part of their culture and their traditions. And they go in there and they do like the sweat. It's basically, they set it up like a sweat lodge and they do all sorts of really, beautiful traditions in there. And he said that became such a huge part of his recovery there while he was there. Anyway, his whole story, we were standing there in the Hogan because we were there for a tour with the FLP class, and he all of a sudden just like told me all these things about his life. And I'm like, you're an amazing human. And I'm so glad that these programs were here for you. Like that's incredible.
Yeah. It's much better to send them to help than put them in a cage.
Yeah.
That's always going to be a better solution for people.
Well, and it's amazing because, I mean, you hear stories like that, and as beautiful and impactful as they are, what really often strikes me is how often communities are set up in a way where the easiest access that people have to the resources and supports that they need is when they're experiencing that life crisis, whether it's they're having a behavioral health crisis and need to be admitted to a hospital, if it's their personal challenges have led to some sort of criminal act or justice involvement, and so they're in the jail system. We should be able to find ways to reach people before they get to that point, so that it's not that you go to jail to heal, but your community is wrapping around resources and tools and programs that already exist that are meeting people before they get to that point of crisis, where they have those supports. They can engage with peers who have experienced the same or similar life experiences, or maybe very different ones, but are still experiences within that realm of behavioral health, whether it's substance use or mental health. that can help them navigate their life so that they're not getting to that point, or at least not feeling alone on their journey as they're navigating all these different things. So I think that's really the heart of the question of recovery ready communities, and the resolution that we adopted here in Flagstaff is, what can we do to make sure that we are educating our community, providing access, and really caring for community at that point before things get as bad as they can get? How can we make sure that we're not letting it get to that point before we have resources available that people can access easily? Or how can we make it easier to access all of the resources that may exist already within community before they're reaching that point? So I think it's
Right.
a real critical conversation to have, is just asking, why is it that we only address so many different problems, and not just in behavioral health, but also in housing, in public safety, wildfire, all of these things we tend to tackle when they're getting kind of to that point of, if we don't do something, everything's gonna fall apart. And
Mhm.
so, what would it take for us to really be future forward thinking enough to say, if we address this now, it won't be a crisis in the future? We can solve these problems before they're problems if we're
Yeah.
willing to look at them that way.
I had a meeting with a guy who runs a local charity here in Flagstaff yesterday. And he's talking about the exact same thing. I'm gonna have to introduce you guys. Hopefully, we'll get him on the podcast some point soon. Uh, but yeah, part of our conversation was, it's isn't it better to like pay 1 month of their rent or their 1 month of their mortgage once, rather than waiting for them to be kicked out and homeless and lose everything?
Mhm.
Mm-hmm.
And it's going to take so much more for them to get back up on their feet. Whereas, like, a lot of people really just like, if we could pay their bills for 1 month, they'll be okay.
Mhm.
And that they're not going to become homeless to begin with. And it's not going to cause all those other problems that come with becoming homeless. And you're not going to need all those other resources that they're end up going to need, going to be needing from the community, because the situation did get that bad.
Right.
That's exactly what we're talking about here. Like, help them out a little bit. It's the preventative medicine thing.
Mhm. Yeah.
Like, so
Totally.
many of our non-political episodes, the main part of this podcast is healthcare, and we talk to all these people about how, like, if we just don't let people get sick to begin with,
Mhm.
Mm-hmm.
it will be so much easier and cheaper and better, just in every way, for everybody. But that's what we're talking about. Like, it's the same thing in life. Like, don't let
Yeah.
it get that bad, and it's going to be easier for all of us to deal with.
Mhm. Yeah, and probably cheaper. I mean,
And
to be
cheaper.
honest with
That's
you.
part of it. Even the
Right.
money side will be so much easier.
Yeah, the needs are less, and therefore, costs are down and services
It's
are
that single
minimal.
payer healthcare system again.
That would be a really beautiful thing. I'm in vote. I'm in vote. I'm in. I don't even know what word I'm trying to use.
Like, it
I
scrambles your
think it's
brain.
a great idea. I do. Um, so I'm thinking about just like the role of city council. And by the way, I'm very fortunate. I know a few city council members, and they are the most like well connected people. And so, to your point earlier on, Khara, that you had said a big important part of what city council does is create partnerships.
Mm-hmm.
So, like, you've got your hands in so many different things, like the housing stuff, the behavioral health. Everyone brings. I feel like every city council member brings a certain kind of like talent or connections or knowledge, right? And so you
Yeah.
get this, hopefully, right? Like, a board is a good kind of mixed bag of people that bring kind of a very well-rounded approach to
Mm-hmm.
everything. That's good, which is why it matters who you vote for.
Absolutely.
But from a mental health, kind of substance use, we're talking about that, behavioral health services.
Mm-hmm.
What kind of obstacles or barriers are here today? Now, we talked about the good thing with the CARES program. I love the CARES van. We just talked about recovery court. What other, like, what needs to be fixed in Flagstaff? What could be improved? How can leadership at the city council level and anywhere else, how can they help? And let's first talk about what those issues are.
Yeah. I feel like it's so hard. I just had this conversation with a team of past leaders in Alabama, and was they were asking similar questions, and I was saying, it feels like such a cop out answer, but I feel like the number one challenge that we face is the communication challenge. What's the biggest barrier that we're facing in our community is that the system is itself so hard to understand, and people find it so hard to access, even people who are working within that system or working within those teams. So
Sounds
if
like the
you're,
healthcare industry.
yeah,
Yeah.
it's so hard. I mean, if you're a resident who's trying to find help for yourself, for your child, for your spouse, a friend, or a neighbor, it gets overwhelming very, very quickly. People might not know who to call, what services are available. They might not know if they qualify, what insurance covers or doesn't cover, or what to do if there's a wait list. And so often people just get so overwhelmed that they just give up. And that's where you
Hmm.
start seeing that cycle that leads to ultimately crises, whether it's uh, risking, risking eviction, whether it's um, experiencing that behavioral health crisis that challenges so many other things that they're facing. And really, what we're facing here in Flagstaff is, and not just in Flagstaff, I'd actually say across Arizona. Arizona has been identified as a behavioral health desert, which means that the number of providers and workforce and organizations that are working on all of these things are so limited. And they're limited because not only of um, just a limitation in that workforce, but the interconnection of other things. When you're talking about rural communities, then there's challenges with transit. If the closest hospital or behavioral health center or recovery center or anything like that is miles away and you don't have a car, how are you going to access that? Or if you're so rural that you don't have a car and you don't have reliable internet, which is something I've been experiencing today, then how are you supposed to do if someone says, oh, well, you can just do telehealth? Well, no, not necessarily if I don't have that reliable connection. Housing instability is a huge thing. And the fact that people who are experiencing some sort of crisis are trying to navigate these things at what might be the worst possible moment for them to be trying to figure out all of these things, and especially if they're doing it on their own. Where I see our role in that as city leadership, as people who are working in these industries who can build these bridges and make these connections, is that we're able to make these systems and these services much more visible and much better connected within the community. If we can use our platform at that dais or within community meetings or just in all of the different things that each of us is involved in to make people more aware of points of entry, of partnerships that exist within our community, helping people know where to turn and where they can go to get the information that they need. That's a critical thing for us to be doing, and taking advantage of the fact that we're literally seated at a seat that gives us a microphone to speak to the entire community in all of these different ways. So just by raising that awareness, we can make a really powerful difference by making sure that people know you're not in this alone, you're not having to navigate this on your own, and there is someone, at least one person within this community who wants to help and who wants to get you to the place that you need to be and to those connections that you need to make to feel as though you're supported and that you're truly valued as part of the community.
You know, as you're talking, I'm thinking about, I know Flagstaff's special, right? I mean, I think we all know that.
I was just thinking that too. We actually have a much bigger percentage of those people in this town than most places, I think.
Yeah, I think just from, talking with people that live in other cities and towns across the country, Flagstaff is just it's special. It really is. You're a special little snowflake. And
My mom always called me special.
and I do realize like that makes that kind of community connection piece better. Like it's like that less than 1 degree of separation of Flagstaff. Not every place has that.
Right.
We all know each other. And there's these programs out there, right? Yet there's still people that they don't know it's there, right? So there's great programs out there. There is support. And also too, for Flagstaff, for being really as small as we have like, and this is not really a true statement, but like we have like the highest per capita of like nonprofits.
Oh,
I
yeah,
swear.
everywhere.
I would.
Everywhere.
So that's, I don't know if that's actually a true statement. We need to research that. But there are a ton of nonprofits in Flagstaff. Like it is almost like a saturated nonprofit market. I mean, not that a nonprofit's ever a bad thing, right? Because they're doing good for the community. But if people don't know about you, right? If it's not out there, like in the world. So I don't know. How do we communicate that better? I don't know. What do we do?
Podcasts.
Oh yeah, they should all come on this podcast.
Yes, exactly. But yeah, I mean, I think it is, as much as we're kind of joking with that answer, that's really what it is. Using whatever platforms we have available to get that information out. I just recently had an email come through to council that was talking about the lack of care that someone felt that they were receiving from behavioral health providers, and feeling like there was not access, programs weren't available, all of these types of concerns that they were raising. And at first, I mean, a lot of times our practice is that if it comes into the general inbox, we're mainly responding when a message comes directly to me. So if someone writes to me directly, that's where I'm focusing most of my time with email responses. But this one was it just hit differently, where this person was really saying they had a child that they were concerned about, who was not able to access care or resources, and they were advocating for their child, is really what the whole point of their message was. And so it really felt like this will be a missed opportunity to not reach out to this person, to let them know, I hear you directly. This is important. I appreciate your advocacy. I want to try and help. I can look into some of the resources that are available, or some of the challenges that you're referencing here, to make sure that at least the right people are aware of it, even if ultimately I'm not the right person to help with this. I can at least do that research to try and figure out who is, and make sure that they get the same information. So whether it's people writing in to let us know what those issues are, whether it's going on the podcast and having those conversations, writing letters to the editor for the newspaper, just making posts on our social media outlets and pages, and engaging with the community in that way. Whatever we can do to get that information out there, I feel like we have an obligation to do. And it can be time consuming, it can be emotionally wearying, but it's still worth it. And I go back to the whole cost factor. It's not what it costs now to do these things, it's what it's going to ultimately cost us if we don't. And so when we're talking about things like, we have that conversation a lot with climate change and carbon neutrality and sustainability within the community, that yes, some of these programs have what seem like very hefty price tags up front. But ultimately, if we don't do any of these things, what is that going to cost us in the future? And I think the same applies very much to behavioral health. If we don't address these things now, we're going to lose members of our community, whether they're moving away to places that they can find better resources, or if they're deciding there's nothing for me, and we're losing people, and we can't afford to lose people. That's just ultimately the goal of all of this, is to protect our people, recognize that everyone within our community is a neighbor, and that's somebody who's worth caring about, and helping them to not only stay alive, but thrive, within this community, because when they thrive, we all thrive.
You know,
Well said.
you know.
Um,
And even like a lot of our forest fires are started by homeless people living in the woods.
Mm.
Like if we gave them a place to stay, we don't have to worry about the town burning down so much. Like there's big implications to it in a lot of ways.
yeah,
You know?
such
Yeah.
domino effect, right? Of these things that you don't always see as interconnected, but they are.
Yeah.
Right. I
Yeah.
think that's
The last time Flagstaff almost burned down, it's because some homeless guy lit his toilet paper on fire
Oh,
in the
that's
woods
right.
because he thought that was the way to get rid of it because he's not from around here.
Yeah.
Well, yeah, and
Yes.
I mean, we spoke earlier about the social determinants of health, and that's where I think people really need to be able to recognize how interconnected all these things are. If you don't have a home, then you don't have access to those basic needs and basic resources that ensure that you're able to take care of your health. Um, when home is not the thing that you're most worried about, then you're able to pay more attention to healthy diet and education and maintaining work and all of those things. At the same time, if you don't have access to medical care, behavioral health care, all of those sorts of supports that uh, help us to maintain not only our physical bodies but also our mental status, our wellness overall, then it it's not that it doesn't matter if you have a home, but home starts to fall away from the things that we're focusing on, to the point that if a crisis gets so bad that we stop focusing on all these other parts of our life, then we stop paying bills. We're not going out. We're not engaging with the rest of the community. That's where you start seeing all of those types of things that just kind of exacerbate and roll into this huge ball that becomes the ultimate crisis that can lead to then you losing that home, or you losing access to food, or all of these other things. Something that seems as small as access to a sidewalk might seem small to me in an area where I have ready access to sidewalks all throughout my community. But think about what that single lack of a curb or a ready to use sidewalk means to someone in a wheelchair, someone who doesn't drive, someone who doesn't feel connected to the rest of their community, and then they're looking out their front door and seeing my home matters so little that I don't even have a sidewalk. I mean, it becomes a huge thing to someone who's already experiencing other challenges. So I think so much of the conversation is about taking that bigger picture view and recognizing that there are no small challenges within a community. They're all interconnected. And as we're addressing one, we're working on others as well. We need to keep them in mind and make sure that we're working on all of these things collectively, not in competition with each other.
You know, as you've been talking, it's made me think about, and you said something earlier on, and I know this. So a lot of decisions are made around healthcare, right, at a national or a state level. So you think about Medicaid, Medicaid or state programs here in Arizona. It's Access. Medicare is a national program through CMS. So when we start seeing cuts to Medicaid, for example, right, and even cuts to Medicare, right, all of these things that we're starting to see kind of pulled back on these social safety net programs, because so many people, if you don't qualify for Medicaid, but you make too much money to qualify for Medicaid, but you can't afford healthcare, so many people fall into that space. And now all of a sudden you don't have insurance, and our healthcare system, for good or for worse, is dictates, right? Dictates how you get care, if you get care, if you can afford it, all of these things, which is totally wrong. And we need to change that. And that's why the uprising exists. But I like to put that one in there. But how do you deal with that, like at a local level, when those aren't your decisions, but you're seeing the fallout, right, at a local level? It's like these nonprofits that have to kind of pick up the slacks. Maybe, I don't know. Like, what are you starting to see? Are you starting to see some of the trickle down effect of that? What can you do? What can
Oh,
we do?
absolutely. I think one of the things that we've been seeing in communities like Flagstaff, or very different from Flagstaff, but just across the country, is that as these things are trickling down from whether it's the federal level or the state level, it's putting a lot of pressure on those local communities um, to get innovative, to get creative, to navigate things in ways that they're just not used to navigating them, and have conversations that they've never had to have before. The silver lining, I think, to all of that is that Flagstaff is known as a city of innovation. And in my mind, innovation means creativity. And if there's any place in the state or in this country that I believe can tackle these challenges in creative ways, it's a place like Flagstaff, where we are rich in the number of nonprofits. We are rich in the number of people who are seeing the real impact of these challenges on our friends and neighbors and family members, and the people that we care about, and wanting to do something about it. The one thing that Flagstaff is never going to do is be silent when it comes to challenges that we're facing. And we see that all the time at city council meetings. We see that all the time. And if you're just reading the newspaper and seeing all the letters to the editor, and I think it's a wonderful thing. I mean, even though sometimes people are coming at a point of absolute frustration and anger sometimes with the topics that they're bringing up, what that speaks to me more than anything is passion. They are passionate about this because they know that there's a challenge that's being faced. They don't know what to do about it. They know that it's not really their responsibility to fix this problem, but they see that the people who are responsible for it are just not hitting the targets that they need to make things better. And so when they're coming and saying, you're not doing XYZ, that can be, yes, very hard to hear, but it also tells me I care so much about this that I'm going to come and talk at you for 3 minutes to tell you that this is a problem, that we need to solve this and we need to fix this. And so when it comes to our local leadership, again, advocacy is huge. One of the things that we've seen more than I think uh, in at least a very long time, or if not more than ever over the past maybe year or two, is the number of times our mayor has been going down to the state legislature to advocate for and speak on behalf of bills that are coming from the state level and make sure they understand how those things are going to impact a community like ours. We've had a lot of conversations with our state legislators and our federal legislators about the impacts of housing, the impacts of uh, behavioral health and uh, infrastructure, transit, all of these things that are really having major impacts on communities like ours. If we're not, again, using our voices to speak at those levels and to speak to the people that are ultimately making the decisions, then we don't get to just wash our hands of it and say, it's not my choice, it's not my decision. I wish something different had happened, but what could I do? Well, what we can do is go down and lobby or log into the system and put comments in on bills as they're coming forward. Make sure that we're truly representing our community in every way that we can through those conversations. Um, I think it's also part of that advocacy is really speaking to what local impact looks like. So when decisions are being made at the state legislature or at the federal level, that are going to have very real impacts on our community, we need to be storytellers in those moments and go to the legislature, whether it's going in person, writing letters, sending emails, making phone calls, whatever it is that we can do to ensure that we're talking to people to make sure they understand this is how it's going to impact my community. These are the concerns that are coming up from my constituents. And this is the population that you're talking about impacting in this way. It's going to be a major factor. We might feel like a small town in a huge state, but really we have very powerful voices on this mountain. And if we're willing to use them, we have a lot of opportunity to make a lot of really positive change,
Yeah.
I think.
I agree with you. Actually, I think that is another thing that makes Flagstaff, I think, such a unique and special community is that we have a lot of loud voices here. I
Mm-hmm.
don't know what it is, but we are like this is like collectively like the most passionate, motivated, like community invested people that I've ever known in my life. And I've lived in quite a few places. So.
It's that kind of town. It's not an easy town to live in. You
Mm-hmm.
kind of have to like create your own job here or something for a lot of people. You know, like there's not a lot of jobs in Flagstaff, but the people who really want to live here, you have to have that mentality of life where you do have that passion and that drive and that focus of you're looking to accomplish something. Because if you don't approach life that way, I don't think you make it in this town.
Yeah.
Yeah.
It's very hard to live here in a way. And if you don't have that, I'm going to make my own way mentality to begin with, I don't think it's the town for you.
Yeah. It's got a lot of I'll call it movers and shakers, innovators, change makers. You were saying creative, being creative. It's
all part of the uprising.
It is. We're in the right place. Hey, look at that. We're surrounded by like-minded people. I love it.
Yeah.
Yeah, this is, I'm just kind of watching the time here. I don't want to go over too long.
I can talk about Flagstaff all day.
We sure could, because we love this place. I heart Flagstaff.
Yeah, so much. I talk about it all the time.
Right. I mean, what an honor to sit on council. I absolutely revere our council members and what you do. It's really important. And they're great people. And I think it's a really important role. Our decisions and our impacts start right at home, right?
Absolutely.
And yeah, I mean, sure, voting for, Congress and the faraway lands of these roles are really important, but it starts right here. And also too, like the influence that you have as a city council member on your state legislature, like you were just talking about, you have a doorway, right? Like there is like a pathway into that space that regular community members may not have.
Mm-hmm.
And so you do have influence. Everybody's voice matters, I think, at the end of the day. And
yeah.
but let's fix our own sidewalks, right?
There you go.
So I'm here for that. Yeah.
The more local government is, the more direct an effect it can have on your day-to-day life, really.
Yeah.
Like we spend all our time talking about the federal government, but as much as they're very much affecting a lot of people's lives right now, it's not really kind of typical times either.
Yeah.
Mm-hmm.
But your mayor can actually affect your life in way more direct ways than the president.
Yeah.
Because they're right there. Like they're in charge of your immediate vicinity. Not just the general idea of the country, but your actual town.
Mm-hmm. That's true.
Well, and I think what's so powerful in that is when people are electing their local elected officials, they're electing people who care deeply about this community. Nobody is running for council because they don't care about Flagstaff.
Right. It's a lot of work.
Yeah, I mean, you do it because you love this community. I did it because I felt like I got so much from coming here. I'm originally from Pennsylvania. I came out for grad school and just instantly fell in love with this place. And I felt like I got so much from this community. I felt not obligated, but just strongly passionate about giving back to this community, sewing back into the community and the neighborhood that gave me so many opportunities. Recognizing the challenges that I faced and trying to make sure that other people didn't have to navigate those same sorts of challenges, or just making sure that they don't have to navigate them alone. It's just, we do this because we love Flagstaff and we love the community. We love our neighbors. We love all the people that live here, even the ones that yell at us, because they make us do this job well. And that's the way I view this. And I think that it's the number one thing that I want people to understand about what I see our role as in city council, but also in, other arenas of work, is we're all part of this community. So whether we're talking about our council members, our firefighters, our police officers, our doctors and nurses, all of these people are folks that were either born and raised here or came here by choice, fell in love with this community, and decided that they wanted to stay and contribute back and build their lives and support the lives of everyone who they serve within this community. It's such a powerful and beautiful thing if we look at it that way and recognize that there's not us versus them. It's all of us trying to figure out how to live this life and do this life together in community, sharing all these resources and recognizing that if I'm doing well but my neighbor isn't, then I'm not doing well. That's my philosophy of it, and that's how I view our overall community. If I'm housed but there's hundreds of people flowing in and out of the shelter every day or every month, if there's one person that I'm driving by on a street corner who is having to ask for basic money to get the smallest of resources or feed a beloved animal or anything like that, then my life isn't as good as it could or should be because there's someone who's within my life who is not at that same level. So what can I do to build everybody up to that same place to get to experience life in the way that we all think that we should and we all deserve? If I'm not focusing on that, then I think I'm focusing on the wrong thing.
That's a beautiful thing to end on, I think, Khara. Thank you so much for coming on. This has been a different conversation, I think.
Do you have links? Do you have a website and stuff people can get in on your campaign and all that?
Sure. So my website is KharaHouseForFlagstaff.com. It's all spelled out. I've got social media pages and pretty active on Facebook, Instagram, and trying to get things updated on my website to just keep people informed on what I'm doing and what I'm working on. Primarily, the thing that's really challenging right now is I'm still doing the work of City Council, so I am more focused on making sure that we're doing the things that we need to do than I am focused on being reelected. As much as I care and am passionate about that, I would rather focus in on the work that needs to get done right now than focus on myself and doing that work. That said, I am still very passionate about serving this community, would love people to check out the website. There's a page to contact if you want to send an email or just send a communication through that page. If you have questions or thoughts about anything, I love hearing from people. So please feel free to reach out.
Awesome.
And send her some money too, because we all know they need money.
That's right. That's right.
I'll say it for you. Nice enough not to.
Yes, I will make that pitch myself, but I am 100% okay with you doing it.
There you go.
Well, yeah, this has been, I feel like every conversation that we have on the Your Vote, Your Health series is entirely different from the other. We haven't had one conversation with anybody.
They're
that
different people running for different offices in different places.
Yeah,
so it does show you that running for office in your district or in your county or in your whatever level you're running at is, you have to know what's going on with your district, with your territory that you're looking to represent. Yeah. That's really what these conversations are showing me. If you're not locked into the people that you're looking to represent, then you probably shouldn't be.
Right. No, Khara's locked in.
Locked in.
Vote for Khara.
Vote House.
Khara House for City Council, round 2.
Thanks for joining us on the Healthcare Uprising. Make sure to hit those like and subscribe buttons before you go, and take a moment to think of a friend and hit that share button. You can find us on all the major audio platforms, and we've got video on YouTube if you want to watch us in action.
You can also find us on social media on LinkedIn, TikTok, and Instagram. Just search Healthcare Uprising to find us. And if you're a new company with a cool new product, if you're someone innovating alternative methods for the health and wellness space, or if you have a personal healthcare journey you'd like to share with us here at The Uprising, please email us at healthcareuprising@gmail.com, and we'll get back to you about coming on the show. Well, that's all for this dose of Healthcare Uprising. Until the next time, keep looking for the good in the world, because sometimes it's where you least expect it.
We are not doctors and we don't play one on TV. If you need medical advice, consult with your physician or a healthcare professional. This has been a Shut Up production.